While New York State is implementing restrictions in growing coronavirus hotspots, Governor Andrew Cuomo announced yesterday tiered closures, primarily in Brooklyn and Queens. The changes include the temporary shutdown of schools, businesses, restaurants, and a limit on large gatherings. Joining us now, President and CEO of New York's Northwell Health, Michael Dowling. He's co-author of a new book titled Leading Through a Pandemic, the inside story of humanity, innovation, and lessons learned during the COVID-19 crisis. Michael, thanks so much for being with us this morning. I want to start first by asking you about what's happening in New York. We've long been told that even though it had been suppressed over the summer, it would come back in New York City and across the state of New York in the fall and the winter. I had a call with my kids' school last night where they underlined that fact that we have to remain vigilant because the expectation is that coronavirus will be back in our lives. So how do you see sort of the horizon of when it comes back and how strongly it comes back?
Well, I think it explains that complacency is dangerous. People just get calm and they think that when everything looks good, that it really is good. I think what has been happening recently is an example that this will come back, maybe not as bad as it was before, but we're fighting a virus that comes in waves. And we see this example in Europe. We see this example in India right now. And it is no surprise, those of us involved in it on a day-to-day basis fully expected that we would see another wave coming back. And what's important here is that the responsibility to deal with this is everybody's responsibility and everybody in the community. So selfishness and people in certain communities who decide not to comply with safety measures, not to wear masks, not to social distance, who think that, well, it doesn't matter what I do, but it does matter what you do. And what we're seeing now in New York is a number of communities where the behavior has not been appropriate. And obviously, government has to take the appropriate actions when these things occur. So I do expect that we will see a situation like this for many, many months. And what we have to be doing is be very, very diligent about making sure that we educate people about the importance of prevention. Right now, we are not seeing that many hospitalizations. There has been a small uptick in our health system. Yesterday, we had about 110 patients. It's very different from what we had back in March and April, where we had 3,500 patients in our hospitals. And we don't want to see that again. This is nothing to take lightly. COVID is not something that you just don't have to worry about. It is around, and it depends upon what the public does on an ongoing basis each and every day.
Doctor, not going to have you comment on the president, but the contention he put out in some of his videos is don't let it dominate you. You can beat it. What are the death rates? Are they going up? Are they going down? Is he right? Is it going away on that front? Are the therapeutics better so that the COVID experience is less painful and lonely? Or what's the reality, sir?
Well, the reality is we know more about the disease today than we did back in March and April. There are more treatments because of some of the trials that have been going on, as well as the experience you get when you deal with this. But if you get COVID in a serious way, it does dominate you. So when we have leadership talking about it, it really doesn't matter, or you don't necessarily have to take precautions. This is very, very dangerous. In fact, it is not leadership at all. It would be interesting if way back a number of months ago, we had national leadership that basically stood up and said, you know, we're at war against a major virus. And I am going to show you through my example and educate you that all of us in a unified way across the whole United States should be taking every safety measure that we possibly can. So you have a unity of purpose, a unity of mission. If we had done that nationally 5-6 months ago, we would be in a much better position today. But it is very, very difficult sometimes to be telling people in one part of the community, whether it's New York or California or whatever, to say, you should be doing all these things because, for example, masks work. And then you have national leadership saying, well, masks may not work. Who cares? I'm not going to wear it. And I'm going to have meetings all over the place where people don't have to wear masks. So you don't have any unity of purpose, any unity of focus. Leadership is about telling the truth, dealing with reality. It's about bringing people together. We didn't bring people together here nationally, and this is one of the reasons that we have the difficulties that we're in right now. We could have been in a much better situation if you had national leadership that dealt with the reality of the situation, and not what they presume might be their own reality. So I'm hoping that everybody takes it very, 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 very seriously. We went through an experience here a number of months ago that I don't think we ever want to go through again, and I hope we don't.
We are talking with the president and CEO of Northwell Health and the co-author of the book, Leading During a Pandemic. And Mike Barnicle has the next question. Mike?
Thank you.
Doctor, we all know about what COVID-19 can do to people when stricken by it. But we don't know a lot about the disease, it seems. We know, for instance, as you just alluded to, that there are more treatments for the disease right now. But can you speak to the after effects of the disease? When you get the disease, you quarantine, you're treated medically, 10, 20 days, whatever, but the outlying aspects of it, a month later, 2 months later, the after effects of this disease.
Right. Well, first of all, I'm not a physician, but I am involved in it very, very closely. That's a very, very good question, a very good point, because we have seen cases, including some of my own employees, that had the virus back in March, were treated, were hospitalized, go home, and are now some of them back to work. But there are lingering issues that they still suffer from. We're studying this right now. We see a lot of it with regard to home care programs. So there are long-term results that are negative with regard to this virus. I think it'll take us a bit of time to figure out what all of that means. But it doesn't mean that when you get it, become hospitalized, and then are discharged from the hospital, that you are cured. I don't think we can fully say that. There are lingering issues that will go on, and potentially for many, many, many years. Only time will tell, and research will tell what the actual real impacts are. There's mental health impacts, etc., that will be lingering for a long time. So a very, very good point that we need a lot more research on over time.
All right, President and CEO of New York's Northwell Health, Michael Dowling, thank you so much.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.